Hello and welcome to Medical Dialogues. I'm Mr. Zaman and here's what I bring to you all from the world of medicine. Depression negatively affects breast cancer patients' survival, says study. In a recent study, having depression before or after a breast cancer diagnosis was associated with a lower likelihood of survival. For the study, researchers analyzed data from the Kentucky Cancer Registry to identify adult women diagnosed with primary invasive breast cancer in 2007 to 2011. Utilizing the Health Claims Linked Cancer Registry data, the team classified patients as having no depression diagnosis only before cancer diagnosis, depression diagnosis only after cancer diagnosis, or persistent depression defined as depression before and after cancer diagnosis. Long COVID incidence and severity no worse than post-viral influenza syndrome, says study. In the highly vaccinated population of Queensland exposed to the Omicron variant, long COVID appears to manifest as a post-viral syndrome of no greater incidence or severity than seasonal influenza, according to new research being presented at this year's European Congress of Clinical Microbiology and Infectious Diseases in Copenhagen, Denmark from 15th to 18th April. To understand more about long COVID's potential impacts, researchers surveyed adults with PCR-confirmed infection for COVID-19 and influenza in Queensland between 12th and 25th June 2022. During concurrent waves of Omicron and influenza that occurred in mid-2022, 195 adults diagnosed with COVID-19 and 951 adults diagnosed with influenza were followed for 12 weeks and asked about ongoing symptoms and functional impairment using a questionnaire delivered by SMS linked to a survey. Brain connections involved in epileptic seizures identified. Researchers at the UCL Queen Square Institute of Neurology have discovered a network of connections in the brain linked to seizures in people with epilepsy. The team believe that their findings published in Brain Journal will help redesign neurological operations for patients whose epilepsy can't be controlled by medication. There are 5 lakh people in the UK with epilepsy and 50 million people have the condition worldwide. But 1 in 3 cannot control their epilepsy with medication. For those patients where the source of epilepsy can be pinpointed, neurosurgery can be curative. However, currently only around 30% of patients remain seizure-free in the long term in the frontal lobe. The team analyzed MRI scans of 47 patients who had received surgery to their frontal lobes for epilepsy years earlier. Income rank linked to experience of physical pain, shows study. A new study of worldwide polling data suggests that a person's income rank relative to their peers is linked to their experience of physical pain, with a lower income rank linked to a higher likelihood of experiencing pain. It is the first time such a relationship has been shown. The study found that the link to persist to the same degree irrespective of whether the person lives in a rich country or a poor country. In the study, analysis were made of data from the annual World Gallup poll across the years 2009 to 2018 and consisting of responses from approximately 1.3 million adult survey respondents from across 146 countries. Respondents were asked what their total monthly household income was before taxes. Respondents were also asked whether they experienced physical pain the day before being surveyed, to which they could respond yes or no. The study also suggests that people in poor countries fare no better than those living in rich countries when it comes to the effect of the absolute amount of personal income they earn on the likelihood of them experiencing pain. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe and press the bell icon.